So what I'd like to talk about this evening is adult immunizations and with a focus really on COVID. So we talked a bit about immunizations 2 weeks ago and about adult vaccines really. And this time we'll focus mostly on COVID. We've got some information, and I think now with it being a bit on the forefront in everybody's mind, uh, I think it will be helpful to review at least the science that we have. And I want everybody to understand what it is that you're making a decision about when it comes to this. So there are four types currently in development, and we talked a bit about these in the last Zoom meeting. So there's a whole virus, which can be like live attenuated and inactivated. This would be like flu vaccine would be an example of this. And currently vaccines for COVID are being developed in China like this. Protein subunit vaccines, that's where we're focusing on a little piece of the virus or the bacteria that we're trying to fight against. And those often use adjuvants, which we talk about, that help promote that immune response. There's some vaccines being made in China in this regard as well. The nucleic acid, which the two well known, which we have now, are these Pfizer and Moderna vaccines, and these are mRNA. So they're not DNA vaccines, they're RNA. This basically uses our cell protein factories to make the antigen, so that little spike protein that will trigger an immune response. And then the other type that's being made is a viral vector. And basically we take a DNA and it gets dropped into like an adenovirus, which is a common cold virus that can then be encapsulated and brought into our cells. And then we can use that again to make antibodies. We can make that spike protein and make antibodies. So we'll talk about both of these nucleic acid and the viral vector a bit more. And I wanted to show you, and we'll see if this will work. Yeah, it will. Cool. So the New York Times actually has a couple of really cool pages that and maybe I'll just show them to you now. But so there's this coronavirus tracker. And so there are 43 different vaccines in phase 1. There's 20 in phase 2, 18 in phase 3, 6 in earlier limited use, 2 approved for use, and 1 has been abandoned. So it's kind of cool, and it goes through timelines of different things so that you can actually see. And so I just found like this was it's super informative and well written. And I'll return to this because they've also done a really nice job vaccine testing. They explain what happens in the process. The processes are, nothing's being bypassed really. What's happened with this speed is that we don't have data over months or years of what can happen with these vaccines because we haven't had months or years yet. So that's really the only part of this has been shortened. So there's lots of different rumors out there that they're skipping things and this and that. And that's not true. They're still going through this same process. So this is a really cool page to kind of highlight like what are you seeing? And they have a whole bunch of different stuff on COVID vaccines. And the other thing that I would say I found really helpful is like looking at like how does the Johnson & Johnson vaccine work? And we'll talk about these things. But if you want a good reference that I think is well written, it's well illustrated, like I think they've done a really great job of making this information understandable. So for complex information, the New York Times has done a really nice job with it. So this mRNA vaccine, this gets transcribed by our manufacturing processes to create these spike proteins. It's different from a DNA vaccine, and that's where some concerns is if it could hijack our DNA, and it will not. The interesting thing, the studies for these, the outcomes that they have tracked and tracked for really, so that we know for what we call endpoints, is symptoms or a positive test. So these two vaccines so far, the Pfizer and the Moderna, we know with 90+% efficacy right now that they are likely to decrease symptoms and decrease the likelihood of a positive test. That's it. We don't know for sure about transmission. So there's a lot of things we don't know yet, but these are the the endpoints, and we'll talk about each of those. The federal government invested billions of dollars in vaccines, and these have been pre-purchased, so people are not going to get charged for them. We actually kind of paid for them already. So both of these have been approved via that emergency use authorization. And so that goes through that whole FDA process. And really, the emergency use authorization, they still have to do data and studies and tracking with these vaccines. That is mandated. And what my understanding can't happen is no vaccine can be mandated that is under an emergency use authorization. So people ask if it'll be mandated, and I don't think that that is possible with an EUA authorization. So the Pfizer vaccine is really 2 doses, 21 days apart. This is one, if anybody saw in the news, a whole container of vaccines headed to Kodiak. When it wasn't kept cold enough or something happened, but this has to be kept at -80°C, which is -94 Fahrenheit. So to say it needs to be kept cold is an understatement. It has to be stored and transported in that way. Once it is out and opened, I think it's got to be used like in 5 days, because these mRNA vaccines are really fragile vaccines. And so there is a limit with that, as you can imagine, with that storage and transport. So it's been studied in 16 and older. They currently have studies going down to 12, but that is not where it's approved for. It's been shown to be 95% effective at preventing symptomatic COVID infection. And that started measuring from 7 days after the second dose. So really a month after you get that first dose, given that you get the second dose at 21 days. 9 of 10 severe COVID cases were in the placebo group, so the group that did not get the active vaccine. It's interesting, you basically get 30 micrograms of this vaccine. The Moderna, you get 100 micrograms of that vaccine, so it's interesting. The Pfizer vaccine, you have to order 975 of these at a time, so that can present an issue for places. And then vaccine contents, there's concern about adjuvants in vaccines. There's concern, people have said there's aluminum and all of these things. And this has RNA in it. It has 4 different lipids in it. What might be one of the potential problems is there's polyethylene glycol in it. And maybe there's some thought that maybe that's what's causing some of these reactions people have heard about. There's potassium chloride, potassium phosphate, sodium chloride, sodium phosphate dihydrate, and sugar. So that's what's in the vaccine. The Moderna vaccine is again 2 doses, 28 days apart. This is stored and transported at -20°C, so this is far more reasonable. It's been studied in 18 and older. Right now entering a 12 to 17-year-old study, I think is in phase 3. This one's been shown to be 94% effective at preventing symptomatic COVID. So, and that's measured 14 days after the second dose. So this is about a month and a half later. Of 95 COVID cases, 90 of those, including 11 severe, were in the placebo group. So the thought is that maybe this helps prevent, severe COVID. There's question that it may be less effective after age 65. This one, you get 100 micrograms vaccine, so it's really about 3 times stronger, if you will. This can be ordered in smaller numbers, so 100 at a time. So this one Costs a little bit more. It's a bit more stable. This one also RNA lipids, so like cholesterol type lipids, fat, polyethylene glycol again. And then there's a few other things, tromethamine and tromethamine hydrochloric acid, acetic acid, sodium acetate, and sugar. So there's not other odd things in this vaccine. So there is a viral vector vaccine that is in phase 3 right now. AstraZeneca and the University of Oxford are developing this. It's basically using that adenovirus technology. So they basically use double-stranded DNA. They put it in a known virus. This virus is actually a simian virus, so kind of like monkey virus. And then they use that to get it into our cells so that we can then stimulate an antibody to the spike protein. So we're going to be able to create the spike protein. It will not replicate within us and cause another problem. The vaccine is expected to last for at least 6 months when it's refrigerated from 38 to 46. So this will be far more stable. There have been some adverse reactions in Britain, and there is question that maybe half the dose that they're using in the trial is all that will be needed to get the antibody production. Janssen and Johnson & Johnson are also working on a viral vector. They're using a human adenovirus for this, again, designed to make that spike protein. So all of them are focused on creating that spike protein that we then will develop an antibody to. Right now, there's question between the preliminary data said 1 dose. The current trial with 45,000 people is testing 2 doses right now. Again, tested 18 and over, 70% effective on average. As it stands right now, they plan to submit for an EUA in February. So quite likely that this could be our next, the next vaccine that we see. So when can you get a vaccine in Alaska? This actually is based on this advisory committee on immune practices. And I'm going to actually pull up, I think this will give me where I want to go. So I actually lucked out today and I heard Dr. Zink speaking to somebody on a Facebook Live because I was looking for this and couldn't find it. They basically have created these tiers, which I think people have heard about. And then we had phase 1 and phase 2. And we basically, I mean, we have 66,000 or 60, yeah, I think 66,000 vaccines in the state. So we can't vaccinate everybody. But phase 1A of tier 1 is going to long-term care facility staff members, hospital-based, frontline healthcare workers, long-term care facility residents. They basically looked at is like, where does COVID tend to strike and where is it most severe? So who's at highest risk? So you can see, like, I mean, it's ICU and COVID, nurses and docs and ER department and respiratory therapists, and security personnel and environmental, so housekeeping, cleaning personnel. And then in tier 2 of 1A is EMS, firefighters. It also will include community health aides, healthcare workers. And, you know, I think this is probably where more community docs are going to fall in a little bit between there and this tier 3. And tier 3 is going to be for providers who have direct patient contact, certainly those who cannot do remote care or telework, so dentists, things like that. So they will be the next tier. And I think, you know, the question is right now, how fast will we get vaccines? I don't think that's, it's not my knowledge right now, and I don't know where we're at state-wise for that. But again, none of it can be mandated. It's choices, you know, it's not been tested in pregnant people. It's not really been tested in people with autoimmune disease. So So this is kind of where we stand on, when can we get vaccines? That's the plan, at least in our state right now. We have gotten so far basically 3,500 doses of the Pfizer vaccine and just under 35,000, just under 27,000 of the Moderna vaccine. So it's the first of 2 doses for 62,000 people. So even if you were to get vaccinated, you still need to comply with masks, physical distancing mandates. We're not sure about stopping transmission. So the other thing I wanted to talk about a little bit, so there's a few different things. In 1986, basically legislation went through that absolves vaccine manufacturers of any liability. So that's probably a whole nother conversation, but there is something called V-Safe. So if you get the COVID vaccine, they're suggesting that people get this. I think it's an app-based program, but it's an after vaccine safety checker. And you check in daily with symptoms. And if there's any issues, they want them reported, and they get reported to a group called CSIP. I think well, let's talk about CSIP. So CSIP is the Countermeasure Injury Compensation Program. So if something has been federally declared, which is basically where we are, this is a federally declared pandemic. So vaccines and treatments that have been included are COVID-19, Marburg, Ebola, nerve agents, insecticides, Zika, pandemic flu, anthrax, acute radiation syndromes, botulinum toxin, smallpox. So like if any of these, like when it falls under vaccines, emergency mandates for using any of these things, if there's an issue, if you have an adverse effect, it all gets reported to this Countermeasure Injury Compensation Program, which differs from VAERS. So VAERS is a program called the Vaccine Adverse Events Reporting System. VAERS has been in, it was basically formed back in '86. And in '86, there was a law passed to protect vaccine manufacturers and administrators because if lawsuits were happening, it could threaten to cause vaccine shortages, reduce our vaccine rates, and then we're concerned about resurgence of vaccine preventable diseases. And so now we have VAERS. As healthcare providers, we're required by law to report on a specific list of things. We are encouraged to report on any adverse effect. And I will say, as a practicing physician, I think sometimes things get reported. Certainly, anything more severe is getting reported. But I think a lot of times we say, well, you probably got a fever because you got a vaccine, and that's your immune response. And that is true, but at what point is it abnormal? And I would err on the side of like, let's report more things than less things, because that just improves our data on safety. There are a few, interestingly, vaccines that are not covered by this, and that is the newest pneumococcal that is given, shingles, and when a flu vaccine is given out of season. So that to me was really interesting. So if you get hurt then, you might be on your own, so to speak. So, and then the Vaccine Injury Compensation Program is different than who you report to. So this was developed in 1986. This is basically the no-fault alternative to being able to sue a vaccine manufacturer. And people can be compensated if you've been injured by vaccines, but you really have to go through and I don't think it's not so simple as to just, oh, I filled out my form and turned it in and now somebody's gonna compensate me. It's not quite as simple as we'd like it to be, but there is something in place. But just so people are aware that the vaccine manufacturers don't have any liability when they create vaccines. So again, what can we do to protect ourselves? We've talked about this multiple times. Vitamin C, about 1,000 milligrams a day, 2,000 milligrams a day. Quercetin. Quercetin can help get zinc into your cells. And so that is helpful. A lot of people may be familiar with quercetin when we talk about allergy care. B vitamin, zinc, 30 to 50 milligrams daily, melatonin up to 6 milligrams at night, vitamin D. Most of you know, like my recommendation is to have that goal of 60 to 90. So, anywhere from 2,000 milligrams a day to 5,000 milligrams a day. And sometimes in cases, I will recommend up to 10,000 milligrams a day. Super important to manage stress, get outside and exercise each day, sleep 7 to 8 hours at night, avoid sugar, simple carbs, and alcohol. And then I have a slew of references for people to look at. There's a lot of cool data out there. And that's what I have. And these are pictures from biking in the last week. So hopefully everybody has a really good holiday. And I'm curious if anybody has any questions, if somebody wants to throw them in the chat that I can see, or if you want to unmute yourself and ask a question, I'm happy to take a question. Was I so clear and answered all questions? I've had a few questions about, autoimmune disease, people who might be immune compromised because of cancer or medications. The vaccines haven't been tested, in other than really pretty healthy folks. So I think that there's definitely questions. And the longer we should have more, data come out as this rolls out. I mean, I think one blessing in disguise is that we don't have, 700,000 vaccines for our state right now. Is that, as these vaccines roll out, we're going to learn more things. We're going to see more people get vaccinated. And I think time will actually help us. I think right now we're doing pretty well. Most of you seem to be doing pretty well, not without stress, but well. I have not seen, so there's a question, are they starting to test an immunocompromised or planning it in the near future? I haven't seen anything specific about that. And I think that the challenge therein lies really being able to get approved to test something in a specific population that you could be at higher risk. It's kind of like pregnant women, there's just no studies that get approved. You don't get to test on pregnant women. So it's interesting. And I've spoken with some of my OB-GYN colleagues and my maternal fetal medicine colleagues, and they feel like it's probably safe, but I would say we don't have any data to support that yet. Another question, is the state saving half the doses we're receiving for the second dose? That's a really good question. The way I have read what they have given, they have 61,900 vaccines. They're talking about, the way I read it is that's a first dose for people. So the fascinating part would be, well, what if we don't get, are we going to get more doses in 3 weeks? Or, I think that's a good question. And I don't know the answer for that. So yeah, great question. And I will keep looking for, as I learn more things, I will get that information to you. Do I recommend getting the vaccine when it becomes available for the rest of us? let's have a conversation when the vaccine becomes available for the rest of us. I think right now, uh, it's going to be an individual risk benefit for each of us that we need to weigh. I think that it's challenging. Uh, I I thought I was on one side of the fence at one point, and I feel like I have pressure from another side of the fence, and so right now, I think it's a challenge. We know that we know the vast majority of people will not get really sick with COVID, but we don't know who will have longer term side effects. We don't know, or maybe develop autoimmune disease. We don't know that. A very small number of people die with COVID. And so really, if we were to say statistically 5 in 10,000 people die from COVID, well, these vaccines would never reach statistical significance, even if we went down to like, wow, we've reduced it from 5 in 10,000 to 2 in 10,000. That is not a statistically significant number to say that, oh, we are reducing deaths. So, yeah, I think I want to just keep this as an ongoing conversation. I'm trying to educate myself as we go, and I'm going to try to keep, you know, educating each of you as we go. And we all have some different circumstances and different circumstances when it comes to like what are our risks and who do we work around and all of these different things. And right now we don't know if it will like stop transmission. We don't know. So many questions. Uh, Question about assuming we need to stay with the same vaccine for both doses. I would assume yes. If you react with one, would you switch? I don't know. And I think because the mRNA vaccines, if they're both made similarly. So I think if you really reacted to one, uh, I probably wouldn't want to get the other one. And I'd be probably like, I wouldn't want to be getting a second one because we already know these folks, what we're observing is up to 20% of people have some side effect, adverse effect with these vaccines on the first dose. We know it can go up to 50 to 60% with that second dose. So I think I think we can look right now and just go, okay, maybe I'm blessed because I'm not in this very front line that feel like need to decide today. I feel lucky like that. Uh, and the other question is that's brought up in the chat too is like trying to find the place that has the right one. Well, the interesting thing will be, as it stands right now, these are only being given at certain places because of some of the reactions that we've seen. You need to have basically, I don't know if you all know what a crash cart is. Like if you have a cardiac arrest or stop breathing in the hospital, and we call a code red or a code blue, somebody comes wheeling in with this big red cart, and that's got all of our drugs we need to basically provide critical care at the moment. So these vaccines right now have to be given in some place that we can that you can respond. Because if we know we've seen there have been I wrote a note, there have been 6 severe allergic reactions, and out of 556, as of December 20th, out of 556,218 vaccines given in the US, there have been 6 severe allergic reactions. 2 of them have been in Alaska, one in Fairbanks and one in Juneau. And so if you have an anaphylactic reaction, like we have got to be able to get you epinephrine and get you to a hospital. And so where we are right now, I mean, we're not going to Fred Meyer cars to get this one. So I think there are a lot of just different logistics that I think the state's doing a really good job, and I know that they're working on it, but I don't know all the ins and outs of the details of it. And I think it will change as we get more vaccines and we get some more that are uh, more stable, transport stable as well. I think that that will be helpful. Uh, yeah, hopefully that answers some of those questions. Any any other questions? Can I chat with you again when the tier 3 opens? Absolutely. Yeah, I'm thinking as it stands right now, I will plan to do this again the third Monday of January, which is, what day is that? It would be the 18th is when I will plan. But, you know, as we get more information, I will feed you more information, whether we do a quick Zoom to learn more things and communicate, or I can write an email newsletter too. I Most of you have noticed, like if you saw that email, I didn't uh, I didn't put COVID in there. There are definitely things are being censored, if you will, or screened for. You can use whatever word you want. And so I know even like I use MailChimp as a mail service, and people are getting their emails to, like for me, it's to practice members disrupted. Sometimes if it says COVID or so, right now we have to be really careful about that verbiage. But if I will come up with a clever term that you know, and right now I think most of you know what concerning thing we're talking about. So uh, I'll do my best to get that information to you. And if we need to do a quick Zoom like this would be easy, and I'll keep you up to date with information as I learn it. Well, excellent. And if there's any other questions, if you didn't get a chance to ask them, you can please message me through the portal. You can call the clinic. Gene Arcelito will relay a message to me. And yeah, I think everybody keep doing what they're doing right now. Stay safe. We know which, I think all of you have done a really good job. We know which supplements to be taking. People are eating well, and I think in general staying pretty well. So keep up the good work, and I'll probably get this uploaded. You're gonna pin me down. I don't know that I can do it tonight, but probably tomorrow I'll get it uploaded. Sometimes I get faster at trimming them, and then sometimes it seems like I've forgotten how to do it. So I'll get this uploaded, and if there's any other questions, please let me know. Everybody have a Merry Christmas, Happy New Year, be safe. Yeah, be really safe, actually, because if you don't need to go to the hospital, I don't want you to have to go to the hospital for anything, really. So give me a shout if there's any other questions, okay? But otherwise, have a great night. Thank you.